What's up, everyone? Pastor Scott here. I hope you're doing well. This is just a quick little intro for the video that you're about to see. I recorded it earlier on Monday. This is just a real quick run through of some of the things we're learning about the virus, how it's impacting our decisions, and hopefully can be just a helpful tool for you to make sense of all the information that we're inundated with. So in this case, it's not a lack of information, but it's an overabundance of information and how we make sense of it. But let me just encourage you that I think this is important. I think this is the real deal, and I think we need to pay attention. A buddy of mine, a pastor in Kentucky, brought this to my attention over the weekend. He was talking to me. He said, in Congress, Congresswoman Alexandria Ocasio-Cortez is one of the most progressive members, and Senator Ted Cruz is one of the most conservative members. They see the world entirely differently, and yet they see this virus the same way. The Congresswoman posted over the weekend asking her constituents not to go out, not to eat, not to go to shows, but to stay inside. And the senator retweeted that and said, yes, absolutely, it's what we must do. So if you're like me trying to wrap your mind around what's happening, what really is going on with this virus, why is it so important that we stay inside and keep our distance? Well, hopefully these next 20 minutes or so will be helpful for you. Let me encourage you too, before you get started, that there's probably not a video I would watch around with my kids. Some hard, heavy information. I read a blog post from an Italian doctor going through their struggles, uses some tough language in places. So I just encourage you maybe to wait until you can see it in an appropriate way. But hope you're doing well. Continuing to pray for y'all. Keep your eyes peeled for more from us on different ways that we can stay connected with each other over the coming days. But love you, and we'll talk to you soon. Bye. Hey everybody, Pastor Scott here. It's Monday, March 16th. I hope you're doing well. Today's day 1 of our social distancing. Really, I guess day 2 since we weren't together in church yesterday. But it's a new day, a new era, a new experience for many of us as distancing in various degrees begins to be implemented. Within the last 24 hours, 2 significant things happened in our current fight with the coronavirus pandemic here in the United States. The first was that the Federal Reserve, our central bank, began implementing financial relief in a way that we haven't seen since the 2008 and 2009 bailout. The financial crisis. They have committed $700 billion to financial relief to ease the markets. This was in coordination with at least, I think, a half dozen central banks from various countries around the world to help make sure that the financial markets could still function well. In addition to that, they've also lowered interest rates to just above zero, so kind of unprecedented type work and experience, which underscores the significance, the severity of what's going on. In addition to that, the Center for Disease Control just yesterday on the 15th issued guidance asking for all gatherings in all places of 50 people or more to be canceled for the next 8 weeks. Yesterday, Dr. Anthony Fauci, who is the head infectious disease doctor and one of several doctors on the president's coronavirus task force, began telling reporters on the Sunday news shows that Americans needed to be prepared to be hunkering down. So what's going on? Why does this matter? Well, today I wanted to take some time for us to talk about this, to talk about as best we can what we know about the virus, what we don't know, and what could be. Not only does this have impact for us as a church and what the next several weeks look like, but even more importantly, it impacts us in the decisions that we make. We're being asked to continually distance ourselves more and more from each other, and we need to understand why that's significant. Let me start all of this by saying, please do. Please do distance yourselves. For those of you that can, you should. And so that those who can't don't yet have to. We'll talk about why social distancing is important and that it's really one of the best tools in our toolbox right now for combating this pandemic. Well, why me? Why am I the one talking to you about this? Well, let me just preface this kind of explaining a couple of things. First of all, as I've told you before, I'd be the first person to tell you that I'm not a doctor. I'm not a public health official. I'm not trained as a scientist. And so I do not pretend to be or want to be. But as a pastor, I feel like I have a role with you and for you to help make sense of what's going on. Let me tell you a little bit about why I think that. We can look back over the 2,000 years of the church's history, and pastors, ministers, leaders of faith have throughout most of those 2,000 years played an important role in terms of education. Throughout the Middle Ages, for instance, it was often the local abbeys, the monks, the priests who were the only educated people in a community. As recently as here in American history, our very earliest colleges, from Harvard College, Yale College, William and Mary, all were founded with the idea of training ministers. Ministers have always had the privilege of education, and often if you wanted to educate your own child, you would send them to live and work with a minister for a time, particularly for secondary education. And so throughout even our American history, pastors have been educators. Now, thankfully, education is much more available. I am by no means the most educated or smartest person in our community, but I think pastors have a role to play as educators, particularly in times of uncertainty like this one. So I've done my best over the last week and a half or so to learn as much as I can about the virus so that I can share that information with you. Thankfully, again, pastors are no longer the depository of information. Information is widely available. But maybe we can be helpful to our churches, to one another, if we can help make sense of all the information, if we can help catalog it, distill it, and make it accessible and understandable. So that's the heart behind this information. We want to share with you what we know about the virus, how it impacts us, and how it can inform the decisions that we're being asked to make. So here's a little bit about what we know with the virus and why we're continually being asked to distance ourselves. I've showed with you before, we'll put it up here again, this idea of social distancing and the impact that it has on individuals and then the broader growth curve of a pandemic. So the idea is that we are at a disadvantage with this virus for a handful of reasons. The first is that it's brand new to us. That's why we call it a novel coronavirus, a new coronavirus. So we don't have much experience with it, nor do we have any antibodies to it. So antibodies are important. They're a part of our immune system, and they help us once we've had an infection and gotten over it. They protect us from that infection to a degree, sometimes fully in the future. That's why for those of us who had chickenpox when we were a kid, we're not worried about getting chickenpox again. We developed antibodies to it. Well, in this case, no one has any antibodies for the coronavirus. Second, there are no vaccines. Third, we also have a healthcare system that is not anticipating the virus. So our healthcare system knows that the flu is coming. They diagnose the flu every week of every year, but they know that a flu season is coming, and so there is space built into our medical system in order to treat that. Well, when you add a whole new virus on top of that, it's very easy to overwhelm the capacity of our medical system. So right now, when we don't have a cure, we don't have antivirals in a way to treat it, and we don't have immunity built in or vaccines, then we're really at the mercy of the virus. And so the two best tools in our tool belt are hygiene, wash our hands, cough into our sleeve, try and keep our germs to ourselves, and distance. Distance helps the spread of this, or it begins to elongate it over time. Let's talk about that. Why is that? How can that be? How do we know this, right? Does it really matter? Does it really make a difference? This is a big sacrifice, right? But let me tell you, we have good reason to believe that it does, and that it's a small sacrifice compared to the burden, the danger, the impact of not distancing ourselves. Let me tell you what I mean. Here's an image from a webinar put on, by the American Hospital Association. This is from an article on Business Insider a little bit earlier this month. And let me preface all this by saying, too, this information, again, is the best that we can obtain. It's changing rapidly. It's brand new, so the science is ever evolving. We're always learning about this. So by the time you see this, whenever that may be in the future, things could have changed. We're going to do our best to update it. But as of right now, here on Monday, March 16th, this is pretty good information, and we'll provide links to this on our website as well. You'll get this for me in written form as well. But here's an image from the American Hospitalist Association going over some of the data of the virus that we know about. You'll see one of those numbers there at the top is really important. It looks like an R0 or an RO value. It's called an R naught. And that's a way that scientists can track how contagious a virus is. And this is basically what you need to know, that this virus, the coronavirus, is definitely more contagious than several other significant viruses. For instance, you may remember a little over 10 years ago, the swine flu, H1N1 came out. Highly contagious, very concerning. A mutation of the flu had a big impact on us, right? Well, the way these R naught numbers work is they said for every one person that is sick, how many other people will they infect? So if you had a R naught number of 1, that means for every one person that is sick, they will make one other person sick. The swine flu had an R naught value of somewhere between 1.4 to 1.6. And as best we can tell right now, the coronavirus has a 2.5 R naught number, much more contagious than the swine flu, which means right now on average, it's 2.5 people for every one person gets sick. So that way we know mathematically we can expect a doubling of cases every 7 to 10 days. Now these numbers, I should say too, are based on the idea that there's no intervention, that this is a virus or disease coming straight into a population with no immunity, no protection. It just takes over. Well, on the one hand, that speaks to us, right? Because what we just talked about, we don't have immunity, we don't have vaccines, but the minute we begin to implement and change our behavior, the better things get, the lower those numbers can go. So distancing tells us anything we can do to lower the number of other people that we infect, the better. So again, swine flu somewhere between 1.4 to 1.6. The last really big pandemic, the Spanish flu, you may have heard of that, 1918, 1919, infected over 500 million people across the world. That had somewhere between an R naught number of 1.4 to 2.8. So we're in the range. Could be a little bit more, a little bit less, but definitely as infectious as a very other severe pandemic in the past. Now let's talk real briefly. You'll see there about the fatality rate. How sick, how dangerous is this? And it's worse, definitely worse than the flu. The standard variety flu has a fatality rate of about 0.1%. That means 0.1% of the population that gets sick with the flu will pass away, unfortunately. So if you have 1,000 people, that's one person for every 1,000 cases of the flu that'll pass away. Right now, the fatality rate of the coronavirus is around 3.5%. Significantly higher than the 0.1% of the flu. Now, the good news is that we are beginning to believe that the fatality rate in a normal circumstance, if one person in one place got the coronavirus, that the fatality rate would be actually lower, somewhere closer to 0.6 to 0.9%. Definitely higher than the flu, definitely more serious, but not nearly as dramatically higher as going from 0.1% to 3.5. Well, why is that? Why aren't we talking about it as 0.6 or 0.9%? Well, that goes back to, again, this idea of flattening the curve because of our medical system. The good news is that the silver lining in this is that for those who are infected, many will have mild to moderate cases. You'll be able to stay at home, be quarantined, you won't feel good, but you'll get better, no problem. Now still, a significant portion will need hospitalization, but those that do, hospitalization is often helpful and effective, whether it's an oxygen treatment all the way to an ICU stay, or even the use of a ventilator. There's a way in which we can lower the fatality rate to that 0.6 to 0.9%. The reason that it pushes so much higher, 3.5, maybe even 4%, is when a medical system becomes overwhelmed and we don't have the medical resources to give the care that we want or need to every person that needs it, and that's responsible for that. So again, we're back to the question of what can we do? How can we slow the spread? How can we prevent the overwhelming burden on our medical system? Back to the same two solutions right now. wash our hands, distance ourselves from one another. Well, let's talk a little bit more about that, right? What are we hearing in the news, right? That's some from the history, that's some background on the virus. Well, we're beginning to see that one of the other challenges for us right now is our lack of testing. Dr. Fauci, you heard me say his name earlier, head infectious disease doctor in the country, he said of Thursday this past week that it had been a failing, that we had not had as many tests as we needed as soon as we needed them. And so we've been playing catch up. Well, that tells us that we know that there are more people with the virus than have tested positive because we haven't had the tests available to get an accurate count. So we're very suspicious of those numbers. There's also some reason to believe, though the science keeps going back and forth, that it is possible to be sick with the virus and not even know it. That you could be sick and contagious before you have symptoms, or you may never have symptoms. So you could be walking around, unable to get tested, unable to know that you're sick, and you're infecting people all along the way. That's the reason we're so concerned about this high contagiousness number, this high fatality number, burdening our medical system. And that we're being asked not only to wash our hands, to not touch our face, but to distance ourselves. It's our best option right now to take care of ourselves and, more importantly, to take care of one another. On Friday, the governor of Ohio said that they believed they could have as many as 100,000 cases of the coronavirus in Ohio. And then on Friday, Dr. Marty McCary from Johns Hopkins University said that he estimated anywhere from 50,000 to 500,000 people had the coronavirus already. And many of those, of course, we hadn't diagnosed. So when we begin to think about the burden, right, the percentages are pretty good when it's just one case in one place. But what about when it becomes 10,000 or 100,000, 500,000, a million, right? Doubling every 7 to 10 days. We've got to take some action. We've got to do everything that we can to space it out, to lower the burden, to lower those numbers, right? We've got to take care of ourselves and those most vulnerable, those that are older and those that have underlying health conditions, particularly heart, respiratory-related conditions. So that's important. Now, there's more that we can share with you, too, on some of the concerns around forecasts, right, that said, really, if we did nothing, there's a New York Times article published on March 13th that the CDC had done worst-case projections back in the month of February. And these were if the virus went on the loose, we did nothing to change our behavior, what would happen, right? Well, that they said that they could have an infection rate anywhere from 160 to 214 million infections if we just sat around and did nothing. That's how pervasive, that's how significant this could be. Now, the good news is we've started making changes, right? That's why over time you've seen cities, states, now even on the national level, beginning to implement these same challenges, this same distancing as a way to meet these challenges. So here's some encouragement, right? Is it going to make a difference? Does it matter? Let me show you this graph from the 1918 pandemic of the Spanish flu. Remember, a very, very pervasive, very contagious form of the flu back in a time before vaccines, before there was really anything to do. Here's a graph showing the fatality rate both in Philadelphia and St. Louis. Take a look at that. Does it look familiar? That comes from, looks like, our graph of social distancing, right? Philadelphia, the burdensome, high rise, quick drop, right? And then St. Louis, the slow progression, right? The long progression, but significantly lower. You may be able to read on that slide there that Philadelphia, this is a case study in contrasting responses. Philadelphia implemented no social distancing, or rather social distancing quite late, whereas St. Louis implemented social distancing 2 days after the first case of the flu in their community. And that's the result. That's why we believe so strongly in the importance of distancing ourselves going forward. So let's talk just real briefly about what could happen if we don't do this. We've talked again about the hope, the good news, that medical care is available, that it can really help us in a lot of cases, right? Bring down that fatality rate of a lot of people. But it's all dependent upon if the care is available. So there was a Politico article earlier this week that talked about, well, what is our hospital capacity? What is our ventilator capacity? In the United States right now, we have about 925,000 hospital beds. And in terms of ventilators, all hospitals throughout the country, this is based on a 2020 Johns Hopkins study, all hospitals altogether have 160,000 ventilators, about 62,000 full ventilators, 98,000 basic ventilators. There's believed to be an emergency stockpile of about 20,000 ventilators. Now, the needs range in how many people could need a ventilator, but it could be anywhere from 64,000, we're in good shape, to, if this gets out of control, 718,000 ventilators. Early data from China says about 2% of cases need a ventilator. Earlier yesterday, Sunday morning, Britain began asking their factories to stop production and to move towards producing more ventilators to meet a shortage. And they're preparing their senior population of people over 70 to need to be isolated for as much as 4 months. That's how significant, that's how serious this could be. But again, the good news is social distancing works. It helps us. The Seattle Area Institute for Disease Modeling found that even relatively minor changes in social interaction can save lives. For instance, they found that if there were 400 deaths in Seattle by the month of April, simply a 25% reduction in our social interaction could bring that down to 160. If we could push ourselves to limiting our interaction up to 75%, then we could take those 400 deaths all the way down to 30. It works. That's how China navigated this, shutting down the provinces, shutting down parts of the country, and that's how Europe is now trying to deal with this too. Italy, over the weekend, now France and Spain, Germany as well, moving to greater and greater elements of lockdown. It's our best bet, and it makes a massive difference. It's worked in the past, and it's worked in the present. Let's talk about what could happen if we don't take advantage of this opportunity. Italy, unfortunately, they would be the first to tell you, wasn't as responsive as they would have liked to be in hindsight. And the infection rates are continuing to gain steam, almost beyond their capacity to care for. They went in the span of 2 weeks from 322 cases to 10,400 cases. They're roughly, again, only 11 days ahead of us in fighting the pandemic. On Sunday, they reported 3,590 new cases in one day and 398 deaths in one day. A New York Times article has said that doctors in Italy have now been placed on war footing. Exposition centers are moving towards makeshift ICU wards, and they've begun drawing lines on the floor to denote clean parts from dirty parts of the ward. War measures have begun in place, and they've begun receiving guidance from some of their medical institutions on how to provide care when there simply isn't enough care to go around. How do you make decisions about who gets a ventilator and who doesn't? Who gets oxygen and who doesn't? Who gets the care and attention of doctors and who doesn't? And they're beginning to move into that area where they're truly lacking the capacity to care for all of those who need it. I wanted to share, before I wrap up, a few words, a blog post from a doctor in Italy, an ICU doctor, Dr. Maccini. He wrote this on his blog. It's been passed around the internet. You may have seen it. But for us, it's really a bird's eye view, a window into what's going on in Italy. He wrote this over a week ago. And so lots changed for them since then. In really, unfortunately, ways it's only gotten worse. But I wanted to share this with you. I wanted you to hear it. I wanted you to know so that you can hopefully get a glimpse of what we're trying to avoid. Let me read it for you. You'll see his picture here on the screen for some of this. He says, after much thought about whether and what to write about what is happening to us, I felt that silence was not responsible. I'll therefore try to convey to people far from our reality what we are living in Bergamo in these days of the COVID-19 pandemic. I understand the need not to create panic, but when the message of the dangerousness of what is happening does not reach people, I shudder. I myself watched with some amazement the reorganization of the entire hospital in the past week. When our current enemy was still in the shadows, the wards slowly emptied. Elective activities were interrupted. Intensive care was freed up to create as many beds as possible. All this rapid transformation brought an atmosphere of silence and surreal emptiness to the corridors of the hospital that we did not yet understand, waiting for a war that was yet to begin and that many, including me, were not so sure would ever come with such ferocity. I still remember my night call a week ago when I was waiting for the results of a swab. When I think about it, my anxiety over one possible case seems almost ridiculous and unjustified now that I've seen what's happening. Well, the situation now is dramatic, to say the least. The war has literally exploded, and battles are uninterrupted day and night. But now that need for beds has arrived in all its drama. One after the other, the departments that had been emptied fill up at an impressive pace. The boards with the names of the patients of different colors depending on the operating unit are now all red. And instead of surgery, you see the diagnosis, which is always the damned same: bilateral interstitial pneumonia. Now explain to me which flu virus causes such a rapid drama. And while there are still people who boast of not being afraid, by ignoring directions, protesting because their normal routine is temporarily put in crisis, the epidemiological disaster is taking place. And there are no more surgeons, urologists, orthopedists. We are only doctors who suddenly become part of a single team to face this tsunami that has overwhelmed us. Cases are multiplying. We arrive at a rate of 15 to 20 admissions per day, all for the same reason. The results of the swab now come one after the other. Positive, positive, positive. Suddenly the ER is collapsing. Reasons for the access always the same: fever and breathing difficulties, fever and cough, respiratory failure. Radiology reports always the same: bilateral interstitial pneumonia, bilateral interstitial pneumonia, bilateral interstitial pneumonia, all to be hospitalized. Someone all ready to be intubated and go to intensive care. For others, it's too late. Every ventilator becomes like gold. Those in operating theaters that have now suspended their non-urgent activity become intensive care places that did not exist before. The staff is exhausted. I saw the tiredness on faces that didn't know what it was despite the already exhausting workloads they had. I saw a solidarity of all of us who never failed to go to our internist colleagues to ask, "What can I do for you now?" Doctors who move beds and transfer patients who administer therapies instead of nurses. Nurses with tears in their eyes because we can't save everyone. And the vital parameters of several patients at the same time reveal an already marked destiny. There are no more shifts, no more hours. Social life is suspended for us. We no longer see our families for fear of infecting them. Some of us have already become infected despite the protocols. Some of our colleagues who are infected also have infected relatives, and some of their relatives are already struggling between life and death. So be patient. You can't go to the theater, museums, or the gym. Try to have pity on the myriad of old people you could exterminate. We just try to make ourselves useful. You should do the same. We influence the life and death of a few dozen people. You with yours, many more. Again, that was from Dr. Maccini, a ICU doctor in Italy. It's tough words to hear, tough words to read. It's a tough reality to comprehend. We've not, in my lifetime, probably in your lifetime, ever experienced something quite like this. On the one hand, there's hope and good news. With good care, with good medicine, with enough time, this virus can easily be combated. But if we don't heed the warnings, if we don't heed the advice, if we don't heed the call to action, then the price will be exponentially higher. The sacrifice, the pain, the burden, exponentially greater. So here's my encouragement to you and to us. Let's take action. Let's be wise. Let's err on the side of caution. Let me leave you with this. The World Health Organization over the weekend, at least I saw it over the weekend, had an interview with a press conference with one of their leaders who had been leading the Ebola outbreak. Ebola is a deadlier, more contagious disease. Thank goodness that we're not talking about a Ebola outbreak, a smallpox outbreak, all kinds of things like that, right? But he says this was his advice, this was his perspective and how we should respond. He says, be fast. Have no regrets. You must be the first mover. Be prepared. If you need to be right before you move, you will never win. Perfection is the enemy of the good. Speed trumps perfection. Everyone is afraid of making a mistake, but the greatest error is not to move. The greatest error is to be paralyzed by the fear. So here's my encouragement to you is let's act. Let's move. This is an unprecedented time. The reality is that for any other national emergency, for any other crisis, my response as your pastor would be to open the church more. It would be to invite us together more, to weather this in the presence of friends and strangers alike. But this virus has turned the tables on so much, and that really the best response for us is not to gather, but to distance ourselves. At least for now. It's not forever. We'll weather this. Science is good. Doctors are good. There's good hope here. There's no reason to panic. There's no reason to stock up on a year's worth of soup, on 6 months' worth of toilet paper. You're going to be fine. We are going to be fine. But it's our little decisions, right? If we choose to work from home when we can or not. If we choose to go to the movie theater or not. If we choose to take care of ourselves, to err on the side of caution, to stay away from others every time we can, it's going to make more of a difference than we could ever know. So please, I'm asking you, I'm encouraging you, begging you, please choose distance for the time being. Choose to err on the side of the caution. Choose to act even if action itself means inaction. It is a gift. It's a gift to ourselves, to our loved ones. It's a gift to those we don't even know. It's a gift to those most vulnerable. I hope this has been helpful for you. I know it's difficult news, difficult information to digest. But I hope and pray that you are at the same time encouraged, that our actions matter. We can make a difference in how this story unfolds. But please, please take it seriously. It's not a joke. It's not a hoax. It's not a political move of one kind or another. It's a global pandemic. It's a global problem. It's a global fight. And we should fight it seriously, and we should fight it together. And that's what I hope we will. I'm grateful for you. Know that we love you. We're going to continue to find ways to connect with you over these days and weeks apart. If you need us, we are here. And that we want to make sure we as a church community are ready. The moment that we can move from distance to closeness, we're going to be ready not only to see one another, but to help one another in our community in the days ahead. Know that you're loved and remembered by me, and even more so by God. We'll see you soon. We made it to the end. Major bonus points for that. I know that was hard and heavy information, but I hope it was helpful in some small way for you to make your own decisions about what's best for you and your family and those around you. As we get ready to go, I just want to leave you with a thought from Lord of the Rings, actually, where at one point Frodo says to Gandalf, he says, Gandalf, I wish the ring never would have come to me. I wish this wouldn't have happened in my time. So do I, says Gandalf. And so do all who live to see such times, but it's not for them to decide. Rather, it's for them to decide what to do with the time that they've been given. Earlier today, the head of the World Health Organization said that this is the greatest public health crisis of our time. And I don't think in some ways it's incorrect to think of it as a battle. And so how we spend our time, the decisions that we make, matter. I don't mean to say that we should panic or that we should be worried, but that we should be of sound mind, right? As Paul reminds us in Timothy, that we should make wise choices. Between the time I recorded this video earlier in the morning and this one now here in the afternoon, getting ready to post it, the first study was published in the journal Science, showing that stealth transmission, meaning people who don't exhibit symptoms of sickness, are a major contributing factor to the spread of the virus. And until we get our testing to the level that we need it at, it's a real concern, a real danger that we could be passing the virus to each other without ever knowing it. So while it's hard, while it's frustrating, while it may even seem a little bit silly, I really do believe that distancing is our best bet right now. Not forever, not for always, but I know for me at least, I don't want to look back and wish I had done something different. This is serious. This is the big time, and I would encourage you to, as much as you can. And I know you can't control every minute of every day, but as much as you can, to try and keep that distance, to try and buy us some time, to buy us some relief, to figure this out and to walk through it together. Know that I'm grateful for you, love you, and we'll be in touch soon, all right? Take care of yourselves.